Let's talk about the day's biggest headline, the one that impacts the maximum number of people. The malaria vaccine. The World Health Organization has finally approved the world's first anti-malarial vaccine. Why is this such a big deal? Well, I'll tell you why. Every 2 minutes, a child dies of malaria. Every 2 minutes. This vaccine can save that child and millions of others. The vaccine is called RTSS. It is 40% effective, and that too not against all types of malaria parasites. This vaccine targets the parasite that's most common in Africa, Plasmodium falciparum. The vaccine can prevent 4 in 10 cases of malaria, 3 in 10 severe cases, also reduce the number of cases where blood transfusion is needed by a third. It's a 4-dose vaccine, with all doses given between the 5th and the 18th month of a child. How long did it take for the World Health Organization to recommend this vaccine? The European Medicines Agency authorized it in 2015. The WHO sat on it for 6 years. How long did the development of an anti-malarial vaccine take? Centuries. Malaria has been claiming lives since the Mesopotamian civilization. In the 20th century alone, malaria claimed nearly 300 million lives. Let me repeat that, 300 million lives. Then why did it take so long to develop a vaccine? Was science not in its favor? Well, the problem was not with science. The problem was with lack of political will. You see, research needs money and push. But the countries devastated by malaria are the world's poorest, mostly African countries, where a lot of families cannot even afford a mosquito net. Malaria was not the priority of the West. I'll show you some numbers. There are 229 million cases of malaria every year. 94% of these cases are reported in Africa. The continent records more than 400,000 malaria deaths every year. And most of these victims are children. Outside Africa, less than 90,000 people lose their lives to malaria every year. So the world chooses to not care. In contrast, consider the Wuhan virus. It affects rich countries too. In 2020, the Western world was suffering, the economy was suffering, so companies deep dived into research and governments poured in millions of dollars to create vaccine on priority. The US alone donated $9 billion for COVID development in 2020, $9 billion in 1 year. What about the malaria vaccine? The entire world pooled together $7.3 billion in malaria research from 2007 to 2018. That's less than $1 billion every year. Yes, the malaria parasite is more complicated than the Wuhan virus, but the story for the extremely delayed development of a malaria vaccine does not end there. The truth is, a malaria vaccine has never really been a priority. You saw how COVID vaccines smashed all records. We were rolling out doses in speed one couldn't imagine in the pharmaceutical world. The world made not 1, not 2, more than 22 Wuhan virus vaccines in 20 months. 7 of them have already been given emergency use authorization by the World Health Organization. 124 others are in clinical development stage, 194 in preclinical trial. And I'm not making this up, I am referring to WHO data. What explains the speed? The vaccine makers, the approvers, the donors, they all had the required incentive. Our world has 7.8 billion people. We need at least 15.6 billion doses of Wuhan virus vaccine if everyone is to receive at least 2 doses. I'm not even talking about the third booster shot. 2 doses alone creates an instant demand for more than 15 billion jabs. These vaccines had a market. A malaria vaccine does not have a market this big. Africa is a continent of 1.3 billion people. That's the population of India. Demand for a malaria vaccine is concentrated in just sub-Saharan Africa. WHO estimates say there could be a requirement of 110 million doses per year by 2036. That's not a big market, not big enough for pharma giants to book their resources. There is also not enough money to be made with the sale of each dose. You see, in the case of Wuhan virus vaccines, rich countries were ready to cough up money, as much as required. EU, for example, is reportedly paying more than $14 per dose of a Pfizer vaccine. 1-4. The US is paying close to $20. African countries are not going to be able to afford this. Malaria vaccine makers would have to print their price tags, keeping in mind the economic state of Africa. WHO estimates say a malaria vaccine will cost anything between $2 to $10. GSK, or GlaxoSmithKline, the company producing the malaria vaccine, has said that it will price the jab at 5% above the cost of production. 15 million annual doses will be produced for now, and these vaccines will also be made in India. GSK has partnered with India's Bharat Biotech. Another vaccine called R21 is in stage 3 of clinical trials. It is being developed by the Oxford University. It will be made by the Serum Institute of India. That's all very well, but could all of this have been fast-tracked? Perhaps. Had malaria overwhelmed the hospitals of New York, Italy, Spain or China, perhaps the story would have been different. And we sincerely hope it doesn't spread to these parts. That's not what we are saying. What we are trying to say is this: for Africa, malaria is worse than COVID. Malaria killed 386,000 Africans in 2019. The Wuhan virus killed 212,000 in the last 18 months. Burkina Faso has a population of 20 million. Every year it records 11 million cases of malaria. Every year 4,000 lives are lost to malaria. This is COVID on repeat. Just that it's worse. And because all of this is happening in Africa, it never makes it to the headlines. But now that we know how fast vaccines can be developed, let's try to not be blinded by profit. The world should apply this urgency to develop vaccines for other diseases too. HIV, for example, it jumped from animals to humans around the 1920s. That's 100 years ago. We still don't have a vaccine. Not a single HIV vaccine has made it beyond phase 3 of the clinical trials. Vaccines, you see, are a lifesaver. And we have come a long way. We've defeated smallpox, polio. But there is still no long-term vaccine for tuberculosis, for West Nile, Zika, HIV. The malaria vaccine, we say, is a great start. But there's a long way to go. WION is now available in your country. Download the app now and get all the news on the move.